These are the untold stories of the ER.
Renal Failure came in complaining of fatigue and dehydration. She had not eaten for 2 days, she had been nauseous and had severe diarrhea. She has a history of hypertension and insulin-dependent diabetes. She's currently in end-stage renal disease and on hemodialysis. When we looked at her initial labs, her blood urea nitrogen level was high, but this is expected with a renal failure patient. Her creatinine was 5, which is actually low for a renal failure patient, suggesting malnutrition, which was correlated with how frail she looked. Her potassium level was also high, supporting her diagnosis of dehydration and her need for hemodialysis. Let's go see how she did. Hi, Miss Failure. How are you doing?
I'm a little nauseous. I still got the runs.
Oh, goodness. I'm sorry to hear that. I'm Elena. I'm going to check you out real quick.
Okay.
Okay. I need you to open up for me. You're looking a little dry.
I feel it.
Oh, I'm sorry. Okay, can I have your hand real quick? We're going to check your skin turgor. Looks like you're having a little bit of tinting. I'm going to feel for your forehead, feel the warmth.
Do I have a fever?
I think you have a little bit of a fever.
I've been nauseous and having diarrhea. I don't know what's going on.
I'm sorry. I'm going to check out your fistula, okay? It's vibrating good. Let me listen to it real quick.
Okay.
Sounds good too. All right, well that's all I need for now. I'll be right back, okay?
Okay.
Okay. Since end-stage renal failure patients are on hemodialysis and a limited fluid intake, it's hard to determine dehydration strictly from their lab results. Renal Failure's poor skin turgor and dry mucous membranes helps us determine that she is in fact dehydrated. Good morning, Miss Failure. How are you feeling this morning?
I'm not nauseous anymore.
That's excellent. Well, I'm glad to hear that because I have your breakfast on its way.
Oh.
What?
They've got me on this special renal diet, and I don't understand. I meet with a dietitian once a month, but I don't understand my diet. I really don't get it.
Oh my goodness. Well, let me actually talk to your dietitian and maybe we can clear some of that up for you, okay?
That'd be great.
Can I do anything else while I'm here?
Actually, my favorite TV show is on right now, What Not to Wear. Can you play it for me on the TV?
Of course I can.
Okay.
Here you go.
In Seattle, we surprised Denise, a flight attendant whose outrageous style is concealing the real woman beneath the bling. Wait, you can tell.
Well, I'm just interviewing some people in front of Walmart for their grocery shopping. I'm trying to kind of get an idea for what people in Jacksonville like to eat. Okay. What kind of stuff do you have on your grocery list today?
Well, here's the thing. I have end-stage renal failure, and I'm supposed to be on this special diet. I don't really understand it. I don't think anybody does. So, I get what I want. I'm gonna go get, I'm a girl. I'm gonna get some chocolate. I think there's a football game on this weekend, so I'm gonna get some party food, some potato chips, hot dogs, grilling stuff. Maybe some bananas to try to be somewhat healthy. Some oranges.
Okay, great. We'll have fun. Today to surprise Renal Failure because her family submitted her for a renal diet makeover.
I think she's shopping in this aisle now. Let's go see what she's up to.
Excuse me, Renal Failure?
Yes.
Hi,
Hi, I'm Lou.
And I'm Henley.
We're from UNF's What Not to Eat.
No.
Edition. Yeah. We got you. You totally got me.
Yeah,
man. We got you. What are you shopping for today?
Well, getting some groceries.
Well, why don't you show us some of the things in your cart?
Okay. Well, I have some bananas and an orange.
And potatoes. Renal failure. This is a hot mess for a
what
renal
is this?
failure patient.
Well, it's not a substitute. I'm not allowed. I'm supposed to be restricting my sodium intake.
Do you know what this has in it?
Fake salt.
It has potassium, 610 milligrams.
I don't understand. Why is that bad?
Well, if you have too much potassium, it can stop your heart suddenly. You don't want that.
What? Okay.
Things
So
like potatoes and bananas and oranges are full of potassium, and they're not okay for a renal failure patient.
Why is that?
It'll stop your heart, and we want you to live.
And your body can't excrete all of that potassium, so it builds up in your body.
Oh, okay.
It's stored in your kidneys.
I got you. Sorry.
What else do we have here, Katrina?
Well, there's a football game this weekend, so I got some beef jerky and some potato chips and some jam and jerk chicken soup.
This is so high in sodium.
Really? But I thought it was healthier because it has chicken.
No, this has almost 1,000 milligrams of sodium in just one can. Sodium is really bad because it causes the water to build up in your bloodstream, which increases your blood pressure and can enlarge your heart and cause shortness of breath and cause tachycardia and
Fluid in your lungs.
fluid in your lungs. And that's not good because your kidneys can't excrete out the sodium either.
I guess I don't need that on top of everything else. Okay.
Okay, well, what else do you have?
Well, I am on fluid restrictions.
So you bought Gatorade?
Katrinal.
You got me. You got me. Oh yes, I
How
got
much of that do you drink a day?
Well, I think I'm supposed to drink like about 4 or 5 bottles of water.
No.
Normal renal failure patients can only have 500 to 1,000 milliliters of water a day.
So how much is that?
Well,
That's maybe 2 bottles of water
Yeah.
at the most.
at the most.
So you don't Katrina.
Okay. Well,
You're in need of a serious makeover.
can you guys help me?
We're gonna help you.
Oh yeah, don't worry.
Okay, renal failure. Before you make any diet modifications, you need to check with your dietitian. Henley and I have already gone ahead and checked with your dietitian, and she recommends a diet high in
Protein, but all your protein should be from high biologic value sources. So where are you getting your protein right now?
Well, beans and nuts.
See, those aren't good. You should get more of your protein from things like chicken and fish because they are high biologic value and they replace all the albumin that you're going to be losing on hemodialysis.
I think she said something like that. Okay.
So
I get it.
things like chicken will keep you nice and healthy.
Okay.
Okay, Katrina. Now you said you were drinking how many bottles of water a day?
4, maybe 5.
Alright, well we consulted with your dietitian and she said you should be drinking no more than 1 liter of water a day. A day.
Yeah, and you also have to be careful because I know that you like your soup and I know that you like your ice cream and things like that. And those things that are liquid at room temperature also count towards your liquid allowance. Your liquid allowance.
Okay, I see. So if I'm gonna like be eating like ice cream or like pudding or something, maybe not pudding, but like a popsicle, I should drink a full thing of water.
Right.
You want to have as much liquid as in this bottle a day. If it's water, ice cream, popsicles, Jello,
And that's
no
1 liter?
more than no more than 1 liter.
But you
I think
know,
I can do
water is
that.
always the best choice. So
No more Gatorade.
no more Gatorade and limit the ice cream.
That's gonna be hard, but okay, I can try.
We believe in you.
You can do it, Katrina.
Oh, look what we have here. Apples. Do you like apples? Yeah. Well, apples are perfect for you with renal failure because on the renal diet, you're not supposed to have very much sodium, as you know.
Right.
So apples, they have 0 sodium in them, and they only have a very little amount of potassium. Also, instead of eating all those chocolate brownies, which has who knows what in it, these are fresh, and they'll satisfy your sweet tooth just as well.
I could do that.
So
So an apple a day really might keep the doctor away for you. That would be nice.
Let's keep shopping.
What else do we have? Oh, cabbage, your favorite. That looks like lettuce.
This is just cabbage. So, cabbage is good for you because it's low in sodium, potassium, and phosphorus.
Yes.
And you can eat that instead of maybe the canned beans or something like that.
Yes. So you could eat cabbage instead of those canned green beans and the canned corn that has all the sodium. Okay. Yep. Okay, and also, we know that you like potatoes, so we thought of a really cool alternative for you.
Mashed cauliflower. Have you ever had that?
Yeah.
Do you like mashed potatoes?
I love mashed potatoes.
Okay, well, what you can do is you can just mash up the cauliflower, maybe add some garlic, which is really good for you also, and that's a great substitute for potatoes.
So they don't have the potassium and sodium. No, nothing. And it's okay to just sprinkle a little bit of flavoring or use things like garlic or other like peppers to season things, but you want to really limit your calcium and your sodium and your potassium intake.
And one last thing, we did check with Katrina's dietitian before we recommended these changes to her diet, just as you should if you're in renal failure.
Yep, your dietitian knows best.
Okay, Katrina failure. Now that we've shown you how to modify your diet, you think you can do it on your own?
I can do it! I can do it! We believe in you! Yeah!
So proud of you.
Here we go! I need my car.
Miss Failure. Wake up. I'm sorry to wake you.
I just had the weirdest dream.
Oh, goodness.
No more TV for me.
Well, I'm just here. The doctor requested that we take your blood work, so I wanted to wake you up. Someone will be right in to do that, okay?
Okay,
Okay, so can I get you anything else?
I'm good. Thank
All right,
you.
Sit tight.
Hi, I'm Dr. Nephron. I'm Renal Failure's physician. After reviewing her blood work, we noted that her white blood cells and platelets were normal. Her red blood cells, hematocrit, and hemoglobin were all low. This indicates that the patient is anemic and is not making enough erythropoietin. So to take care of this, we're going to prescribe erythropoietin-stimulating protein and an iron supplement.
These are the untold stories of the ER.